Every year, more than 20,000 people in Australia and New Zealand break their hip. A broken hip is also known as a hip fracture. Men and women over the age of 50 are most at risk of breaking their hip from a simple slip, trip, or fall. A hip fracture is a life-changing injury. It can be emotionally exhausting and treatment options can be confusing. Knowing what to expect after the ambulance has taken you to hospital can make a difference and allow you to actively participate in decisions about your care. The Australian and New Zealand Hip Fracture Registry helps to improve hip fracture care for older people. The registry has developed 3 types of resources to help you understand what to expect when admitted to hospital with a broken hip. These resources were developed from conversations with people who have experienced a hip fracture, either as a patient or as a family member. These resources will help you know what care should be offered at the hospital, decide what care is appropriate for you in partnership with the health professional looking after you, and plan your recovery after you leave the hospital. Resource 1. The Hip Fracture Care Guide provides information to help you know what is happening while in the hospital. It includes space to write down questions you may have, your goals of treatment and recovery, a care plan developed with the health professionals for when you leave hospital. Resource 2. We know that a hip fracture affects the person with the injury and also their family and friends. We have developed a set of resources just for them. We call them the Carer Resources, and they have been developed to give carers important facts about a hip fracture and its treatment, ideas about things to discuss with the health professionals, suggestions on how to provide practical support to their friend or relative during their recovery. Resource 3. The Consumer Dashboard allows you to see real information about the care provided in Australia to older people who have been admitted to hospital with a broken hip in the past year. The dashboard allows the information to be filtered by different characteristics like age or walking ability, which lets you see the care provided to someone like you or your friend or relative. To access any of these resources developed for patients, families and friends, or to find out more about the Australian and New Zealand Hip Fracture Registry, please go to the website at www.anzhfr.org.